And it's been more than 40 days since Israel blocked the entry of all basic life essentials into Gaza. The health ministry says the shortage of medical supplies is hindering doctors from completing emergency interventions. Hundreds of patients are not receiving medicine or treatment, and the blockade is just worsening their suffering.
Unfortunately, as the ceasefire is violated or stopped, we already, the gates are closed. No medical supplies here in Gaza nowadays. We have shortage in the drugs. We have shortage in the medical supplies. We have shortage in everything in the hospitals. Even the team is exhausted. They are working 24 hours over 24 hours.
Let's take this on now with Laila Baker, who's the Regional Director for Arab States at the United Nations Population Fund. She was in Gaza recently, now joins us from Cairo. I think, Laila, you were in Gaza just over a month ago, if I'm right. What was your experience? Tell us what you saw.
I don't think that any number of newsreels or reports that I have read prepared me for the shock that I saw in Gaza. After the hammering and the bombardment and assault from Israel on Gaza and the Palestinian people there, what I witnessed was extraordinary devastation, both of the infrastructure and of the livelihoods of people in a way that I'd never seen before. What we see on the cameras is only the physical destruction. You can't smell the stench and decay of organic matter, whether that's from garbage or if it's from people who have suffered and are lying under the rubble. And it's an extraordinarily difficult situation to have to witness that and not be able to impact the international community to bring this to a screeching halt. I think the evidence is overwhelming that a ceasefire and a permanent one to bring relief and justice for the Palestinian people of Gaza is exceptionally important at this time.
Indeed. Israel, of course, has cut off daily necessities from food to medicine. And just the mere fact of saying that is very easy to say, but I just cannot imagine what enduring it must mean. What do people in Gaza like the most?
I had the privilege to meet with many of the women and girls who UNFPA does our best to serve, even under these extraordinarily torturous conditions. I went to where our women's and girls' safe space was thriving for the last quarter of a decade, and now is only a hole with a pile of rubble. And despite those circumstances, I witnessed the tenacity and the commitment and the dedication and the insistence of the Palestinian people to remain on Palestinian land. For many of the women and girls who are there, they suffer triply: displacement, they suffer with their own health, with many of the health facilities and the infrastructure almost completely brought to a halt and in ruin, with medication and supplies being denied. Their malnutrition is also at risk. And they also are the caretakers for their families. So they put their own health and well-being aside. In UNFPA, even amongst the rubble, we sat in a tent with just a tarpaulin on the floor, and we talked. What I got from those women was, one, that they were proud to be Palestinian women and to live in their country and to remain, to be able to be steadfast and remain on Palestinian land. They appreciated the services of UNFPA and the international community and called for an immediate ceasefire, a return to some sort of stability, and to help to rebuild all of the infrastructure in the communities that has been destroyed by Israel over the last 17 months.
Right. Particularly difficult, of course, these conditions are just awful for absolutely everybody, but particularly difficult for pregnant women. What efforts are being made to help them by your organization? I know that's something you really focus on.
Yes, it is. And thank you for asking the question. Think for a moment to when someone you loved was pregnant and you were anticipating the joy of receiving a new member of your family. There's anxiety, but it's usually a good anxiety. And UNFPA globally serves to try and facilitate both the capacities of hospitals and health facilities and health workers to be able to provide for safe, clean delivery and make that joyous moment actually come to fruition. With the destruction of the health services, over 80% of the health facilities have been destroyed. Very few hospitals that have been built up to be able to provide for safe delivery. And many of the being destroyed, and many of our health professionals either being killed or displaced themselves. Pregnant women are finding it more and more difficult, one, to be able to find a facility, and two, with the bombing that's going on, to be able to get there in safety. And three, even if they could get there, would there be a professional? Will there be aid? Will there be medication? Can they get back to their place, a tent, a displacement center safely? And then with the rising incidence of complications in their newborns, will that newborn actually survive the conditions in Gaza with food, water, shelter being in such limited supplies? I fear for the entire population in Gaza right now. And without a permanent ceasefire and a return to their homes to help rebuild this, the conditions are only likely to get worse.
Okay.
UNFPA and its partners have shown exceptional dedication, and we have continued to provide services, but it's getting harder and harder each day.
Indeed, it is a desperate, desperate situation, but so important to bring it to light, and we appreciate your efforts, Laila, in doing that just now. Thank you so much for joining us. Laila Baker, the Regional Director for the Arab States at the United Nations Population Fund.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.